Prostate cancer treatments can boost survival, but they can also damage your bones. Here's what you need to know about how prostate cancer treatments can cause osteoporosis, as well as how to prevent it and treat it. My name's Dr. Tom Forfa, and I reversed my osteoporosis naturally, without drugs, using my medical knowledge. This channel is for men with osteoporosis who want to reverse it naturally too. Hit the subscribe button to get our latest videos. So prostate cancer is the second most common cancer diagnosis in men and the fifth leading cause of death globally. It's a big deal. There have been huge advancements in prostate cancer treatments, so men are living longer and often receive multiple lines of therapy over the years. Overall, this is a positive thing, but it can also mean that these treatments add up and have a cumulative impact on your bone health, leading to an increased risk in osteoporosis. Chemotherapy can do this, but mostly it's androgen deprivation therapy, otherwise known as ADT, that has been studied thoroughly and shown to cause rapid bone loss and higher fracture risk in men. The way this happens is ADT reduces levels of testosterone, a hormone that is crucial for bone health. Testosterone stimulates osteoblasts, which form trabecular bone and helps osteocytes prevent bone loss. When testosterone levels drop, bone resorption increases, leading to decreased bone density and a higher risk of fracture. Plus, testosterone is converted to estrogen via aromatase, which further supports bone health. The lack of these hormones during ADT accelerates bone loss. Now, this is not a reason to not do ADT, but it should be taken into consideration when planning treatment in the following ways. Firstly, it's important to acknowledge that men with prostate cancer have a higher prevalence of osteoporosis and osteopenia even before starting ADT because of the population group and other risk factors like advanced disease. In which case, ADT may worsen pre-existing poor bone health. So this is why early screening and prevention for osteoporosis in men with prostate cancer is really important. But on top of that, the treatment itself increases the prevalence of osteoporosis. The number varies widely across different studies, and it ranges from 9% to a 53% increase in the risk of developing osteoporosis while on the treatment. But here are the 5 key risk factors for osteoporosis in men undergoing ADT, as discussed in the position statement by the International Osteoporosis Foundation. So this has been thoroughly researched and approved. So there are 5. Firstly is advanced age. Gentlemen getting prostate cancer tend to be on the older side, and that can also be a risk factor for osteoporosis. Number 2 is the duration and intensity of ADT. Multiple rounds and multiple medications for ADT increase the risk. Number 3 is a low baseline bone mineral density. So if someone's already in osteopenia or osteoporosis or headed there, that's a risk factor. Number 4 is a family history of osteoporosis. Number 5, lifestyle factors like smoking, alcohol consumption, but also low body weight, all of which are risk factors. So putting the disease of osteoporosis aside for a moment, men on ADT face a severe risk of falls and fragility fractures. A systematic review of 100,000 men on ADT found a 23% increased risk of skeletal fractures and a 39% increased risk in vertebral fractures. When you consider that morbidity and mortality in men with these fractures is significantly higher than in women, especially for hip fractures with a mortality rate of 20% in the first year, this further emphasizes the need for pre-treatment screening, as well as regular bone health monitoring and preventative strategies. Now, before we address the treatments for men with osteoporosis who have had ADT, here are the 6 crucial steps to preventing osteoporosis in these men in the first place. It requires a structured, proactive approach, but here's a summary of the steps based on a consensus reached in a recent multidisciplinary review. The first one is a regular bone density testing. Men starting ADT should undergo a baseline DEXA scan to assess their bone mineral density. Follow-up scans should be conducted periodically, no more than once every 12 months, to monitor changes in bone density and identify early signs of osteoporosis. Number 2 is laboratory tests to investigate for potential secondary causes of osteoporosis. Men suffer secondary osteoporosis at much higher rates than women, so looking into this is important. Number 3 is calcium and vitamin D supplementation. Adequate intake of calcium and vitamin D is crucial for bone health. Supplements should be prescribed as needed to make sure patients meet the recommended daily intake. Number 4 are non-pharmaceutical interventions. There are a number of these, and they have been shown to help prevent and treat osteoporosis. But we're talking about the 6 steps to prevent it in men on ADT. So non-pharmaceutical interventions, number 1 is diet. Encouraging a diet rich in calcium and vitamin D. Secondly is exercise. Regular weight-bearing and resistance exercises have been proven to maintain bone strength, muscle mass, and help with balance and falls prevention. The third non-pharmaceutical intervention here is avoiding risk factors like reducing alcohol intake and quitting smoking, which are significant risk factors. They want to reduce those. And finally is regular and prudent exposure to sunlight to encourage that vitamin D. Okay, so we're talking about the 6 ways to prevent it. The 5th one is pharmaceutical intervention. Now, this has been shown to be effective as well. Firstly, we've got bisphosphonates, which can help prevent bone loss by inhibiting bone resorption. They're often prescribed for men on ADT to reduce the risk of fractures. Denosumab, this is an alternative to bisphosphonates, working by inhibiting a protein involved in bone breakdown. And the last suggested pharmaceutical intervention is selective estrogen receptor modulators, or SERMs. Now, these can mimic the effects of estrogen on bone, which helps to maintain bone density. And the 6th way to help prevent osteoporosis in men going through ADT is patient education. Educating men about the risks of osteoporosis and the importance of bone health is crucial. Patients should be informed about the benefits of lifestyle changes and sticking to the prescribed treatments. And that's one of the reasons why we started this channel. So subscribe to learn more about osteoporosis and how to prevent it, or see the description for our online educational program for men who have been recently diagnosed with osteoporosis. Now, as for effective osteoporosis treatments for men with prostate cancer, now obviously you need to speak to your doctor about this, but generally speaking, there are 5 keys to this. The first is diet. So a diet rich in calcium and vitamin D is important. Exercise programs, tailored exercise regimens can significantly reduce the risk of falls and fractures. And a study highlighted in the Journal of Urology shows the positive impact of regular physical exercise on bone health and fall preventions in these specific patients. And more specifically also fall prevention strategies, so home safety assessments and modifications to reduce a falls risk alongside physical therapy to improve balance and strength. And then we've got medications, as we mentioned earlier, not just to prevent, but can also be used to treat. Bisphosphonates and denosumab may be required to reduce bone resorption and increase BMD. And we've also got the potential for hormone replacement therapy. For some men, testosterone replacement therapy might be considered, balancing the benefits and the risks. But the connection between prostate cancer and osteoporosis is clear, and it underscores the importance of a comprehensive care plan that incorporates proactive bone health management. Early detection, lifestyle modification, and targeted treatments are crucial in preventing fractures and ensuring long-term well-being for your patients and for us men who might be watching this as well. Hit the subscribe button to receive more videos about men's osteoporosis, and I'll see you next time.